Get you something fancy.
Really what?
Chiropractic, our monthly health talk. We're very excited to have you here. Happy to see you. Your presence here means that you care about your health. You're interested in knowing how can you do things that positively impact your health. We're gonna give you some information on some things that you might be doing in your life that's negatively impacting your health as well. And also we're going to talk about chiropractic, of course, and how it can benefit your health. So before we begin, I want to introduce the office staff. We have Dr. Deborah Little, of course, owner and operator of Genesis Chiropractic.
Hello.
We have Miss Brianna Owens, soon to be Mrs. She's our billing manager. We have Dr. Ryan. He's our intern from Life University, actually graduating in about 2 to 3 weeks. So that's big right there. and I'm Dr. Wright. So to begin, we want to talk about health. What is health? When the average person thinks about health, they think about how we feel, being symptom-free, being disease-free. And this definition is pretty good, but it's not a real good judgment of health. Us as chiropractors, we think of health as the body's ability to heal and function at an optimal level. Throughout life, throughout our daily routines, we have things that can negatively impact our health on a daily basis, and we call these stresses. We have different categories of stresses, but we have 3 main types. We have physical stresses, biochemical stresses, and psychological stresses. So our physical stresses can be anything from motor vehicle accidents, improper posture, injuries and accidents that we sustain on a daily basis just by doing our daily activities. It could be not stretching before you're doing a strenuous activities. All of these can have different negative impacts on our physical body. We also have biochemical stresses. This is our nutrition. This is the food that we take in. A lot of the food that we eat these days is pretty bad for us, and it can be toxic to our bodies, and that can also have a negative impact on our physical health as well. And last but not least, we have psychological stress. Now, psychological stress, when you have a physical ailment, a lot of folks don't think of the psychological stress as playing an important part in this. But I'm here to tell you that that's not true. Psychological stresses can have just as big of an impact on our physical health as physical stresses. So it's important what you think about, it's important what you put into your mind, it's important what you consider. They say that if you allow yourself to consider something, if you allow a thought to enter your mind, then you become flexible to this thought. But if you don't think about it, you don't consider it, you don't allow it to enter your mind, your heart kind of becomes hardened to this, and it can have, no impact or a little impact on your health. So always remember it's important, what you think, what you allow to enter your mind. Okay. So you might say, how does this relate to chiropractic? What does chiropractic have to do with my health? That's what she's looking like. How does chiropractic relate to my health?
This is relating to me right now.
Okay, so I want to start off with an analogy. How many of you have ever been stuck in traffic on the highway?
Oh yeah, all of us.
Yeah, living in Atlanta, everybody at some point in their life has been stuck in some type of traffic. So I want you to think of that highway as what we call your central nervous system. We think of this system as one of the most important systems in your body. It is the master control center of your body. It regulates every function in your body, from your breathing to your heartbeat. Our central nervous system is composed of our brain as well as our spinal cord, which is housed inside of the spinal column here, these bones here. So let's think of the cars on the highway as electrical impulses. Electrical impulses are the way that the brain communicates with the body. Okay, so the brain communicates with the body, and the body with the brain. Okay, so say you're on the way to work one day and you get stuck in traffic. That traffic is going to slow you down, or either you're not going to be able to get to work at all. If you can't get to work, you're not going to be able to get your job done. It's the same way with the central nervous system. If the brain is not able to communicate with the body, you're going to have some kind of dysfunction in whatever organ the brain is trying to communicate with. Everybody kind of understand that so far? Mm-hmm. Okay, so whenever you have dysfunction, your body is not going to be able to operate efficiently. So what is this traffic? What causes this dysfunction? What causes that blockage between the brain and the body? What causes this electrical impulses not to flow freely? Well, in the real world, it could be anything. In traffic, it could be anything from roadblocks to construction to police, whatever. But in our body, in our CNS, it is called subluxations, vertebral subluxations. And from there, I'm actually going to pass it on to Dr. Ryan. He's going to talk about vertebral subluxations. He's going to talk about how they can have a negative impact on your life, your health, and he's going to talk about how chiropractic can be beneficial to removing these subluxations, allowing your body to function at its optimal capacity. Okay?
All right. Thank you, Dr. Antoine.
Hey everybody, my name is Ryan Pollard. I am 2 weeks away from graduating, so I will be a doctor very much so soon. I'm going to continue on the conversation that we're having about chiropractic, and I'm going to start off talking about subluxations. So, few people kind of know what subluxation is, but you might know it in a different term. You might know it in that something just doesn't feel right about me today, or I feel a little off, or I don't feel 100%, or something's just bothering me. And then sometimes it might be something severe like, man, these bills, man, they just keep piling up, or man, I really hate driving around in Atlanta traffic, or I really hate so-and-so because they keep getting on my nerves, asking me about dumb stuff every day. So subluxations can start from a mental or a physical aspect. They can affect you in various different ways, down to your body's chemistry. They can affect the way you move, they can affect the way you think, they can affect the way that your body functions, and they can have very deleterious actions on your body. So it's kind of imperative that you want to remove those subluxations and those stresses from your life. So you say, well, how do I do that? Well, some people get the misconception that chiropractic only takes care of, oh, my back hurts, oh, my neck hurts. Well, chiropractic works a little differently. We don't just look at just the back or the neck. We look at the whole body as a whole. You have nerves that run out from your back. Everybody knows that kind of without nervous function, things would cease to work. So if things didn't work, it's okay, sir.
I just have a great question.
Yes, Dr. Lynn.
When we talk about subluxations, are we talking in the language that we understand because you guys are doctors? Are we talking about when the bones or some things in our body are not lined up right, are misaligned?
Well,
is that one of the things that it composes of?
That can be, but kind of to break it down to a term that most people can understand, I just use the word stressors. And so when you don't have full function in your body, or you have a stress, be it a physical or a mental or a chemical aspect, it can cause problems. So, lack of motion can cause a subluxation. Eating wrong foods can cause subluxations. Having bad thoughts can cause subluxations. And they can manifest in various different ways. We as chiropractors have different ways of treating and finding these subluxations or stressors. So, when a person comes into our office and they're coming to get treatment, the first thing we do is we're going to ask them a range of questions. What's your job? What do you do every day? Because that can put a lot of stress on your body. What do you eat normally? Because that can put a lot of stress on your life. What's going on with your life right now? How did you come into this office? Were you hurt? Did you just feel a little off? Did something else happen? Did a friend refer you? So, these are all ways that we're looking to help you and kind of put together a whole picture of your health so that we can help you the best way we can, because we want to improve functionality in your life. So after we found the subluxation, we want to treat it. So the way to treat it is an adjustment. So a lot of people might use the term pop, crack. There's a few different other words. Well, we don't pop or crack anything, we just adjust. And the noise that you hear is the sound of carbon dioxide being released. The sound you hear is the release of carbon dioxide from a joint that gets built up over time. So it's no different than the sound that you hear from this, or this, or this. And the bone's not breaking. That's just the joint being released from each other, and the carbon dioxide is coming out, making a noise. So whenever somebody gets their neck adjusted, you know, a lot of people say, oh, I feel like you're cracking my neck. We're not cracking your neck. We're adjusting your neck. And we're trying to align it so that you won't have any interference, so that you can be at your most optimum, so you can function every day. You can't crack a neck physically from a human being. It takes a very traumatic event to crack your neck and break it. So, you know, we want to kind of just erase that whole notion and that doubt right now. So when you go to get your adjustment, you'll lay down on the table and you'll feel some palpation, and we're just trying to find out some indicators of where you might have a stress in your body at, also known as a subluxation. So once we do that, we'll analyze you and then we'll go ahead and adjust you. And there's various ways that we adjust you. There's an instrument, there's our hands, there's blocks, there's the table that drops from up under you. We're using all those to just kind of come up with a way just to adjust you so that we can get movement back into your body, so we can alert your body that you're getting movement so that it doesn't start locking things down, decreasing range of motion, creating inflammation and creating more problems in your body. Everybody kind of knows about inflammation. That's a big key word that everybody hears. You always want to remove it. Oh, I got to take my antioxidants so I can remove inflammation. Well, chiropractic does that too. So it doesn't just come in the form of food you eat. It comes in chiropractic as well. So a lot of you might say, okay, well, yeah, you were saying chiropractic helps with more than, you know, my back or my neck hurt. What else does it do? Well, studies have shown that chiropractic can help with your immunity function. Tests have shown that it increases your immunity ×2 and its response time ×2 as well. You say, well, what else can it do? It can help with diabetes. It's been shown to decrease glucose levels after subluxations. You say, what else can it do? It's been known to help with CD4 cells, which are very important in people that have immunodeficiency diseases. So your cancers or your AIDS. You say, what else can it do? It's been shown to help with colic. It's been shown to help with different neurology problems. It's been shown to help with just a whole myriad of things. And studies have shown that chiropractic really does help with that. So it's not just for your back. It's not just for you. It's for your kids. It's for your wife. It's for your grandma. It's for everybody. So with all that said, we hope that we've kind of shed a little bit of light on what chiropractic is and what chiropractic can do. And we hope that, you know, you take this gift that we're giving you and you just share it with as many people as you can, because I think that chiropractic is the best thing going. And it's not just because I'm about to be a doctor. I wouldn't be a doctor in this unless I honestly believed in it. I've gone as far as adjusting my cousin who was just born because of the traumatic events of the birthing process. You have to send, I'm pretty sure we all know, something the size of a watermelon out a hole the size of an orange. That can be very traumatic on a baby's body. So you will want to have that child lined up perfectly and any interference removed so that they can start their life with the best advantages they can. Just imagine how many kids go through that process and never get looked at until they're 40, 50 years old. Well, by the time you've got 40, 50 years of stress on your body, I think we can all agree you're not going to be in a good state as you might have been had you been starting from day one. Kind of like we could all agree if a person was to eat fruits and vegetables their whole life and they turned 40, they probably would be in a whole different place than somebody that ate McDonald's since they were 1 to 40. I think we could all agree on that, wouldn't we? So imagine what would happen if you got chiropractic from day 1 all the way till you were 40 and up. Where your body would be, what condition you would be in, and how much better your quality of life would be. So again, we just ask of you that you don't keep this great thing to yourself. You tell as many people as you can about it. And before I leave, I'm going to tell you one quick story about how I knew chiropractic really worked. I had a patient who had been having headaches since she was 3 years old. You shouldn't be having headaches at 3. You don't have the chemistry to have headaches at that time, but she had been having them since she was 3 years old. When she came to visit me, she was about 25. Her headaches were so bad that she got an MRI at 5. You should not be getting an MRI at 5. You shouldn't have any issues like that going on with you. After she was under my care, and I'm talking as soon as the second adjustment, she stopped having headaches. She said, I didn't know I could not have headaches anymore. It doesn't mean that every story is going to be a miracle. It doesn't mean that as soon as we adjust you, you're going to get up off the table and start doing backflips and have x-ray vision or anything like that. But what we do, little by little, can improve your life and put you in a new place that you never thought you could be in. So we ask of you again, just, take this information that we've given you and, share it with as many people as you can. And thank you so much for coming out, and we hope you have an awesome day.
Thank you. Do anyone have any questions for Dr. Ryan? Like how old is the oldest patient here at Back to Genesis Chiropractic?
And the youngest.
And how old is the youngest?
I don't know how old the oldest is, but I know the youngest had to be a baby that came in.
Mm-hmm.
And our oldest is 89.
88.
88.
Mm-hmm. Our oldest is 88.
And she's on no medicine.
None. None. No medication at all. And that's another wonderful thing about chiropractic. Not saying that people are not on any medications, that they won't take anything, because sometimes they do. But I can say that most chiropractic patients, as a whole, compared to people who don't see a chiropractor, the ones who see a chiropractor take less medication, have lesser surgeries.
Less debilitation, more
Right.
functionality.
Exactly, more
Just like-
advantages.
Just like children who are under chiropractic care get less infections, less
Yes.
sickness,
Yes.
less days off from school because of illness,
Hmm.
and recover a lot quicker from illness.
Exactly. And the conditions that we've seen in this office, what different people might have. I've seen people, of course, diabetes, type 1 and type 2, HIV, high blood pressure, neurofibromatosis. Did I say that right?
Yes, that's right.
Say real fast. Just almost every condition, and I try not to focus, or we try not to focus on the disease itself, but we try to focus on the nervous system and try to correct it so that the body can work at its best ability. I mean, two people might have the same condition and they both may be under chiropractic treatment, but because everyone's blueprints are so different, they may react differently to the treatment. One may see results right away, whereby the other one may not see results until weeks or months down the line. It just depends on a whole lot of things. So, but as Dr. Ryan said, I wouldn't trade chiropractic for anything in the world. I truly believe in it. And I remember two of my grandchildren were born premature. Like one was under 2 pounds and one was just 2 pounds. And I remember they were on oxygen because their lungs weren't fully functional and they were just having a hard time breathing. I remember my first chiropractic seminar, there were lots of women chiropractors around. And here I am carrying these heavy tanks around with me, I promise. One of the doctors adjusted just a small bone right in the first bone of the baby's neck called the atlas. And that night, they didn't need the oxygen tank. And then the second night, they did not need the oxygen tank. And then the third night, I took them to the hospital to have a sleep study done. They slept through with no distress. That was the last of the oxygen tank that they needed. So stories like that, you hear them over and over again. So we asked, does chiropractic work? I would be afraid not to try it. Before I try things that are invasive, I would encourage people to try chiropractic care. Because when my children were babies and I would take them to the doctor, we would come home with big bags of medication. Not when they're under chiropractic care. Again, not saying that the medication is not necessary, because sometimes medical intervention is necessary. But sometimes it's so abused and misused, and many people get sick from it or overdose from it or die from it. just from the wrong prescription, just from taking too much of it, just from the side effects itself. So many times doctors tell them they need to have back surgery, but then they come to us first, which is, I think, is a smart idea before getting something so invasive done. And a lot of them end up not having to have the back surgery. So as Dr. Ryan was saying, I really highly recommend chiropractic care. And if you have any questions or concerns, you can just feel free to ask any of us, and we'll try to answer you as best as we can. But thank you for coming. Thank you so much. Well, you had to. You got to sign up.
Yeah.
But I'm glad you came. This is your first visit with us, so I'm glad you sat through this, so maybe you could understand a little bit more about chiropractic.
Yeah, I like that because this is the first time I've been somewhere. I find a meeting like that, so that the people know better, about something they get to do. I tell the Pastor Mitchell, say thank you, because they sent me there. I had a Monday afternoon, like 2 o'clock. I coming from Cock Parkway. I'm passed to where they give you the social security, the food stamps. When I pass the corner to come into South Carb, to come so before the bridge, I have somebody, I was over the right line. When I was on the right line, I give it the signal, people the signal, tell them, say, I want to turn on the left line. When I wasn't over there, I turned on the left line, and boom, they hit me. Because some people, when you're driving, they don't care if you give them the signal. Let them know you get to turn. They don't care about that. Now, I give a signal since maybe 15, 20. He don't care. Just he follow me closely, just hit me.
He was behind you?
Yeah, he's behind me. Because I was on the right line. I want to turn on the left line. I give him the signal, tell him I get to turn the line.
Oh, so you got over to turn, and he sped up and hit you
He hit
from
me.
behind.
But I see the police give me the ticket. But I don't know why they give me the ticket. Because since he hit me, my truck turned it wrong over the next line. The people get coming down.
And how'd you feel after?
Yeah, just the police give me the ticket. I don't know.
How did you feel physically after
After that, I don't feel nothing. But when they happen, I don't feel nothing. But when I finish like 3:30, 4 o'clock, I get the hair. They hit me so hard. I get my neck, so they hit me. This line, my door is break. My job can fix no more.
And I think almost half of us in here have gone through auto accidents. Someone hit me very hard from behind.
Yeah.
I'm gonna eat the crust, but don't take that. Someone hit. Well, I don't want to tell everybody's business, but I can tell mine. Who in here don't mind telling people they have been in an accident before?
I have. I've been ran off the road.
I've been in that accident before. Since I'm living in the West, I'm coming from church. Somebody follow me.
Someone was driving us.
They hit me behind. When they hit me, me and my daughters.
And that's a bad feeling. You talking about different stresses. When you're rear-ended or side-swiped or your truck turnover, I mean, you're going through one physical stress because you're probably hurt, and if you don't feel it that day, believe me, you're gonna feel it the next. You're going through psychological stress because you're like, oh my God, what happened here? Because you're almost in denial. This can't be happening to me. This happens to somebody else. You're going through emotional stress because at that point you might be a little angry. If not at the person who hit you, you might just be angry at the situation. This does not happen at a good time. You know, I'm on my way to work. I'm on my way to school, or I'm on my way to the airport to go on vacation. This is not a good time for this to happen. I just got this new job, and I don't need anything to interfere with it.
Well, there's no
So, right, so now there's no car. Now you have to deal with the insurance company to try to get a rental. Then you have to talk to the people at work to try to explain to them, I'm not going to be at work today because I have to go get my car fixed. I have to go get treatment. I have to, and then people aren't as understanding. The electrical people are not understanding. The light company, the gas company people are not understanding. Well, I couldn't work this amount of time because I was in. So your whole world, you're subluxated.
Yeah.
You need a chiropractor because I know I did. So there's so many things, but going through an auto accident is really no walk in the park. So we do understand what you're going through. But anyway, thank you for coming, and this is your first time.